Hello viewers, welcome to V Academy. Please subscribe our channel for more educational updates. Today's lecture is about amniocentesis and it is one of the most important topics. Amniocentesis is also called as AFT test. It is also called as AFT test because it is a amniotic fluid test. So to understand the procedure of the amniocentesis, first we have to know what is amniotic fluid. So let us know what is amniotic fluid. This is the fluid which is present in the amniotic sac surrounding the fetus of the pregnant woman. Amniotic fluid is a clear, pale yellow fluid. It protects the fetus from shocks and injuries. This fluid consists of fetal cells and proteins. That means the amniotic fluid is present in the amniotic sac. That amniotic sac is surrounding the fetus of the pregnant woman and it externally appears as a pale yellow color fluid. It protects the baby from shocks and injuries, and this fluid consists of shed of fetal cells, so we can determine the genetic abnormalities of the fetus, and it consists of proteins, so that proteins nourishes the embryo or the fetus. These are the functions of the amniotic fluid. Now in the diagram we can clearly see the amniotic fluid. See, this is the amniotic fluid. Now let us know about the procedure of amniocentesis. Amniocentesis is a procedure in which a small amount of amniotic fluid is extracted for testing many kinds of abnormalities. Now let us know what are the abnormalities which are determined by the amniocentesis. See, simply amniocentesis is a procedure in which a small amount of amniotic fluid is extracted, and let us examine the abnormalities by which amniocentesis is preferred. See here, the amniocentesis is used for testing chromosomal abnormalities such as Down's syndrome, Klinefelter syndrome, etc. It is also used to test fetal infections. It is also used to test fetal lung testing. That is, the fetal lung testing is done to determine whether a baby's lungs are mature enough for birth or not. And another one is paternity testing, that is the DNA test, that is collecting DNA from the fetus and then comparing the DNA to the DNA of the father. This is called as paternity testing. And another one is if any one of the parents are carrier of the genetic abnormalities, and genetic abnormalities are nothing but if the mother or father of a baby are having any genetic abnormalities such as thalassemia, arthritis, Alzheimer's disease, diabetes, etc. And it is also used to test if there is any neural tube defect in the previous pregnancy, and to avoid polyhydramnios. Polyhydramnios is nothing but presence of the excess of amniotic fluid. Due to the excess presence of amniotic fluid, there is a chance of consuming of amniotic fluid by the baby. So to avoid polyhydramnios situation also, this amniocentesis is preferred. In the diagram we can clearly see the polyhydramnios fetus, that is having high amount of amniotic fluid in the fetus. Now let us know about how amniocentesis procedure is done by the physician. See, before starting the procedure we have to give local anesthesia to the patient, and the first step is we have to insert needle into the amniotic sac through the abdominal wall and the uterus of the mother into the amniotic sac. See in the diagram, in this way we have to inject the syringe into the amniotic sac. And after the insertion of the needle, in the next step, the physician with the help of ultrasound scan places the syringe in the amniotic fluid and extracts about 20 ml of amniotic fluid for testing, and the prick of this syringe heals and amniotic fluid is replenished within a day. That is, the amniotic fluid which we have extracted is regained again by the mother. After extraction of the fluid, the fetal cells are separated from it, and these cells are grown separately in the culture medium, and the karyotype is prepared and the chromosomes are examined for abnormalities. Karyotype is nothing but it is the process by which photographs of the chromosomes are taken in order to determine the number of chromosomes and the abnormalities of chromosomes. This is about the karyotyping. First we have to insert needle into the amniotic fluid and we have to extract the 20 ml of amniotic fluid, and the prick of the syringe heals within a day and amniotic fluid is again regained by the mother. After the extraction of the fluid, the fetal cells are separated from the fluid, and these separated fetal cells are grown separately in the culture medium, and the karyotype is prepared and the chromosomes are examined for abnormalities. See here in the picture we can clearly see the karyotyping of the chromosomes after the cell culture. And this amniocentesis is safely performed after the 14th to 16th week of pregnancy, but it can also be done as early as 10th week. And next, let us know about the risk associated with amniocentesis. Amniocentesis carries various risks including leaking of amniotic fluid. Rarely the amniotic fluid is leaked after the amniocentesis procedure. However, in most cases the fluid will be lost in small amount and stops within a week, and the pregnancy is likely to continue normally. And the second one is miscarriage. Serious complications after the procedure of amniocentesis may lead to miscarriage, and performing the procedure before 15 weeks of pregnancy, that means early amniocentesis, may also cause miscarriage. And another one is needle injury. Failure of the needle prick to heal properly leads to needle injury, and it can also infect the fetus of the baby. Another one is infection. Very rarely infection of the amniotic sac is from the needle, and this needle may trigger a infection as I already said. And another one is the infection transmission. If you have an infection such as hepatitis C, HIV or AIDS, this infection might be transferred to your baby during the amniocentesis. These are the risks associated with the amniocentesis process. Due to the higher risk associated with it, amniocentesis is done only when the pregnant woman is 35 years of age or older than 35 years. So, mostly amniocentesis is preferred only in the pregnant of 35 years of age or older than the 35 years of age. And nowadays, due to the advancement in the technology, amniocentesis is less preferred by the doctors as it is the risky process. That means due to the advancement in the technology, amniocentesis is not preferred by the doctors as it is associated with many risks. This is about the amniotic fluid and amniocentesis. Thanks for watching. Subscribe to our channel, V Academy. Thank you.